To the health sector, it means that since the president has said it's among his 4 agendas, it is actually a plus for the health sector. That's what I would say, because once you have the support from His Excellency the President, and that being his main agenda, it means that he's really committed to ensuring that Kenyans receive universal health care. So we really have to sit together and define the minimum package for universal health care. What does that mean? What does it mean that when a client comes to the facility, what is the minimum care that they should be able to receive readily and from the lowest healthcare facility?
I believe now that is set among the big 4, we are happy. For it's recognized that actually health is important. In fact, if you have a healthy nation, then you will be able to do a lot. And therefore, now that we are there and that's what we are talking about, we want more funds to the counties, to the health sector, the funds be ring-fenced so that it is able to do the work that we have in the work plan.
Have all the health functions been followed by resources from the national government?
Unfortunately, not all in all functions that have been devolved, and as you said, the finances have followed it. I can take a very quick example is like training of the doctors. Most of these doctors have gone for training, leaving an artificial gap within our system in the county, but we continue to pay their salaries. So I can tell you, like in Isiolo County, you have 30 doctors, 17 of them have already gone for training. So that creates an artificial shortages.
Our time to first take an advisory role, because the current government have communicated that this is our priority. So we are the technocrats. We are the ones to write the proposals. We're the ones to put a price on them, because then the Treasury needs to know how much to allocate. We are eagerly awaiting the budget that's going to come out later this year, because we are expecting that the government will increase the funding for health. We are hoping for double-digit %.
It also means we have to really define who is going to pay for these services, because universal healthcare services means that a patient walks in and they receive the services without paying for a shilling. So who will finance this? So we really have a role of thinking of what we should do, what measures are we going to ensure that there is adequate